Welcome back to The Wellness Effect. Remember to hit that subscribe button so you won't miss out on any of our episodes. In our previous episode, we discussed the importance of balancing dieting and exercise. Today, we focus on how a dietitian can help us live a longer life. My guest in this discussion is Mbali Mapholi, both a clinical and consultant dietitian and founder of My Nutrition ZA. Welcome, Mbali.
Thank you. Thank you for having me
It's an
today.
absolute pleasure.
Yeah.
So, Mbali, maybe could you break down for us what is a dietitian and what is their role in helping you live a longer life?
Yeah. So in South Africa, a dietitian is a healthcare professional that is qualified to practice therapeutic nutrition, which means that we are trained to use food in supporting somebody's sort of health, whether there is a presence of disease or not. So we are using food, for example, let's say a person is admitted in hospital and they can't eat. Maybe they've got a tube going through their nose that is used for feeding. So a dietitian is the only healthcare professional who's trained to calculate the feed and be able to choose from a wide variety of enteral feeds that we've got, like those, it's like bottles, which is like milky.
Yes.
I don't know if you've seen it hanging over somebody in hospital. So we are then the healthcare professionals that provide that. So therapeutic nutrition. We can practice preventative nutrition, meaning nutrition education, just like what I'm doing today. But our big thing that differentiates us from a nutritionist is that we can work in hospitals and provide therapeutic nutrition. So a dietitian can help somebody, again, as I said, with diseases, non-communicable diseases, any gut-related diseases, mental health, if there is any sort of diet-related issues there, heart health and heart-related diseases, but also if there's no disease and you just want to know, like, how much protein do I need to eat, how much carbohydrates, how much energy do I need to consume for my body to prevent diseases, then we can also help with that. So dietitians work in hospital, out of hospital, wherever there's people and food, basically.
Okay, great.
Yeah.
No, thanks for that, because I always assumed dietitians were only focused on out of hospital. I didn't see the correlation with in hospital as well. Yeah, that's really key.
So it's just like a specialty in a sense that some dietitians will prefer to practice clinical nutrition, which is also what I do. I work in hospital, but also I run an outpatient practice. So I work outside of the hospital. I work with brands as well, which means I'm a consultant dietitian. I work in hospital in the food service space. You're dealing with catering. So yeah.
Amazing.
Yeah.
Now, Mbali, there's so much information in 2024 around different diets.
Yeah.
But what is a healthy diet in 2024?
A healthy diet in 2024 is the one that you can sustain, the one that you can afford, the one that is easily accessible to you. But more than anything, now we know the changes in terms of our climate and food sustainability and all of those things. So the biggest thing is the diet that you can sustain, both for the land you are living in, but also just the bigger picture, which is our earth.
Sure.
So I think that type of a diet. Now, if we're talking about a diet that you can sustain, it means if I like asparagus and you don't like asparagus, I can't say you are unhealthy for not liking asparagus or not eating asparagus or not affording asparagus.
Yeah, what?
Asparagus, exactly. So we need to use what we have. We need to eat what we have.
Correct.
That is a healthy diet. But then we can extend and say healthy diet is the one that supports nourishment, the one that's going to support your body to be able to thrive, to fight diseases, to perform. As we are sitting here, we've had lunch and we can now perform and talk, like, have that brain functionality as well. That is a healthy diet for you. A healthy diet is not a trendy diet.
Yes.
A healthy diet is a diet that works for you.
I like that you mentioned a healthy diet is really around sustainability, accessibility,
exactly,
and affordability.
100%.
Amazing.
We can't ignore affordability.
Yes.
Because when you look 10 years ago, the price of bread compared to now, you can definitely see that we have to sort of make sure that we consume foods that we can afford. Otherwise, we start struggling and living outside of our means.
Correct.
Yeah,
correct,
it's tough times for most people.
And maybe could you discuss for us the different types of diets? Like, I do intermittent fasting. I know there's keto, vegan. Which one is best for long-term health?
Fad diets, which they are called fad diets because of the problem of sustainability. And whether it's going to work for you or not, it just depends. However, on the ones you've mentioned, you mentioned veganism. I want to highlight that veganism is unfortunately categorized as a diet, as a fad diet, but it's not. It's a lifestyle, because it just means you're a person who doesn't eat meat, but doesn't also consume any animal products and clothing and stuff like that that are around animals. But I think when you look into intermittent fasting, ketogenic diet, Benting diet, cabbage soup diet, you know about cabbage soup diet?
No, I'm hearing
Yeah,
now.
South Beach diet,
South Beach.
detox diet.
Wow.
Should I go on?
Yeah, there's many.
The list goes on and
Yeah.
on. There is no one that can be sustainable. Out of all those fad diets, they always have one biggest red flag, is that they're not sustainable. Intermittent fasting seems to be the one that people tend to sustain, more so because most people already fast because of religious reasons. So it's easy to skip a meal. Or other people, even if it's not for religious reasons, they skip a meal anyway. But once you introduce the structure of intermittent fasting, perhaps there is some benefits. But we see it more, intermittent fasting being more beneficial for male compared to female because of our different hormones. So we find that if women skip breakfast, they tend to crave more in the afternoon, which it's just counterproductive in a sense, because you will still eat a little bit more, quite a lot in the afternoon. There is a saying whereby you don't eat any cookie for the rest of the day and then go dinner, you eat a whole big pack of Oreo biscuits. So that's what we're trying to say, okay? If that sort of way of eating doesn't work for you, rather than you eat sustainably, maybe 3 meals a day with snacks in between, that seems to fuel you better. It gives you enough energy, it gives you enough nutrients to sustain you for the day. Another thing is, if a diet says don't eat, excludes a whole meal, like intermittent fasting, or it excludes a whole food group, like we see with ketogenic diet or Benting diet, that's a problem, because each food group gives us different nutrients. As soon as there's a food group that has been eliminated or excluded, we're going to have nutrient deficiencies of some sort. Yeah.
Correct. So let's talk about access. Is it only the wealthy that can have access to a dietitian and have them develop a nutritional plan?
Yeah, no, everybody should, and everybody can. So as I said, dietitians exist at different sort of organizations. Even in the public or state hospitals, you can find a dietitian. There is a referral system that takes place there, but you can access a dietitian. If you need a dietitian, you can ask a letter from your doctor to refer you to a dietitian, especially for stays. But in private practice, you can just go see a dietitian. Many dietitians still claim from medical aid, which means if you've got some medical savings, you can access a dietitian. If a dietitian doesn't claim for medical aid, we use a time-based system for payment. So if you see me for 15 minutes, you can pay for 15 minutes. If you've seen me for an hour, you can pay for an hour. So there are those options. But also there are dietitians like myself who've really invested in nutrition education. So sometimes if you can't completely afford a dietitian and you've got your phone, you've got social media, whether it's Facebook or Instagram or TikTok, search South African dietitians. We are always giving out nutrition information free of charge, and it just helps you as well that you know that the information is coming from a credible source. What I do as well, I work a lot with media, different topics over the years. So if you search my name and search a topic, chances are you'll find that topic that I've commented on, and those are just some of the ways I try to get people to have access to my services if they can physically afford to come to consult. Yeah.
Thank you for that.
And I think COVID helped. Now we've got virtual consultations, which means you can consult with a dietitian anywhere. Telemedicine is a thing now.
Let's talk about food, Mbali. Is healthy food only available for the wealthy?
No. This is a thing, though. People think that if I say, I'm going to give an actual example, a woman needs X amount of milligrams of iron a day, say that's 10 milligrams, I'm just making an example. And then we extend it to say, what are food sources of iron where you can, the food sources that have good iron quantity. Then we extend and say, okay, it's things like beef, it's beans, we extend to going even spinach as well. Now, the challenge there is that if people hear beef, they think, oh, it's only ribeye steak, which is more expensive, but not necessarily. Even lean means is a good source of iron. So it's just understanding that there is nutrition fundamentals where we're saying you need omega-3s, you need iron, you need zinc, you need vitamin D, C, D, E, and all of that. Then we say these are food sources. Out of that basket of food sources, you have to choose what is available to you.
Okay.
If you've got a food garden, make an example with myself. I've got a home garden, and past winter, I had ample spinach, which ended up meaning that every single day we have spinach somewhere in our meals. And spinach is a good source of, as I said, your iron, good source of vitamin C. It's a fantastic vegetable all around. It's got antioxidants. Because I had ample access to spinach, ended up eating it. We ended up eating it every day in the house. Somebody else who doesn't have spinach might have kale. So it doesn't mean that because I've got spinach, I'm going to now say kale is not nutritious just because I've got spinach. So that is something we need to look at and say, what are the nutrients that I need for nourishment and what are the food sources? And you go for the food sources that you can afford. But if you hear Mbali on Instagram saying, oh, berries are the best thing, and then you think they're the only best thing, I think that's where we say healthy eating is expensive, because it just depends on what I can afford. But take what nutrients we need and say, okay, this is a basket of foods that high in that nutrient, and then use what you have.
Speaking about social media,
Yes.
can I follow my favorite influencer's diet?
No, don't do that. Because even if we eat the same plate and go to gym and do the same physical activity and live in the same house, our body composition is completely different. We will still not look the same. So if a person comes and flex on the camera and say, do like a little bit of a flex, and they say this is what I eat in the day, and you eat exactly like they are eating and expect the same result, you'll be disappointed, because chances are you will chase and never achieve that body. So follow influencers for, I don't know, entertainment, inspiration, but don't necessarily follow them for expect advice. I'm speaking from nutrition point of view, because chances are it's biased. Chances are they are paid. And even if they disclose, you're still now caught up in this bubble of not understanding what is it that is really genuine, what is it that is not, what is it that it's not. But if you try to follow experts, we are forced by the HPCSA to be very transparent and to stay away from associating ourselves with certain brands, and sort of those lines have to be blurred,
And is there a one size fits all approach to dieting?
If there was, I would have closed my doors 10 years ago. No, there is no one size fit all. And even in the same family, when I'm doing family consultations, I still make sure that everybody in the family gets to have their needs met. And yes, at the end of the day, we try and make sure that there's one pot, other than everybody having their own pot, because there are sort of shared nutrition fundamentals. But essentially, your diet and my diet can never be the same. So there's no one size fit all, also in a sense that you can't just go to Google and say, give me a diet for losing weight and hope for the best, because that diet might or might not work. Google will never know your socioeconomic status, your preferences, and your physical activity, all of those things that play a role, your genetics, that play a role into how you absorb that food, how you burn those calories as well. So there's no one size fit all type of a diet. Unfortunately, everybody who eats think they know about nutrition, and it's not the case.
Somebody, we've talked about healthy food not just being for the wealthy, but what is the one key takeaway that our viewers can implement almost tomorrow?
Yeah. One thing I say is, especially in 2024, is we must try not to focus on diets that emphasize on exclusion, like avoid, but try to focus on diets that say eat more of this to get this benefit. So inclusion more. That seems to get us to nourishment more than just us being adults that have got not eating disorder in a sense, but like disordered eating patterns.
Yes.
And because by doing that, we sort of, that trickles down to our children. But if we start saying more inclusion, it means two things can coexist in one diet. And it doesn't mean that if you are eating a cupcake it's going to cancel out the benefit of broccoli. It doesn't work like that, but they can coexist so long as we sort of prioritize nourishment. And I say that because people even joke and they say, I'm a mother of nourishment, because that's what I've seen in practice, that if people approach diet as it's fueling my body, it's for optimal health, it's for supporting my day-to-day activities, then they start seeing nutrition as something to embrace than something to hate, because people don't like diets.
It's good.
And they don't like dietitians either because of the term diet in it. But yeah, that's what I think. More inclusion, less about avoiding. Let's just do away with that mentality of avoid. Yeah.
So thank you, Mbali, for sharing your knowledge with us. It was really practical, and you gave us tools that we can implement tomorrow.
Thank you. Thank you for having me again.
Subscribe to our channel to catch every episode of The Wellness Effect. See you next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.